Hello, my name is Dr. Louise Sharkey. I'm a consultant child psychiatrist working for the Health Service Executive. This short video is designed to help you to support your child with an intellectual disability during the COVID-19 pandemic. An intellectual disability is a neurodevelopmental disorder where there are significant limitations in terms of intellectual functioning and adaptive behaviour. Typically, a child with an intellectual disability is impaired in terms of academic learning, communication, social skills, problem solving, reasoning, abstract thinking, and the skills needed for independent learning across home, school, and community settings. There are 4 different levels of intellectual disability: mild, moderate, severe, and profound. An intellectual disability is not a mental health disorder. Most children with an intellectual disability will have their needs in relation to their disability met by their multidisciplinary disability team. However, children with an intellectual disability are at an increased risk of mental health disorders, for example, anxiety disorders, depressive disorders, feeding disorders, for example, pica, where the child persistently eats inedible objects, or rumination disorder, where the child regurgitates undigested food, sleeping disorders, and self-injurious behaviours. Children with intellectual disability are more likely to have additional neurodevelopmental disorders, for example, autism spectrum disorders or attention deficit hyperactivity disorder. COVID-19 presents particular challenges for children with an intellectual disability and their parents. Children have lost the predictability, structure, and routine provided by the school setting. Many children no longer have access to respite. Respite facilities have been temporarily closed as staff have been redeployed to residential services, and staff have been unable to implement social distancing rules. This is a particularly challenging time for parents of children with an intellectual disability who are providing 24-hour care 7 days a week to children with very complex needs without the supports that they would have previously been used to. Firstly, I would advise that you establish a routine for your child and for your family. A regular routine helps to reduce anxiety. Creating a visual schedule for your child may help your child to understand what is expected of him or her throughout the day. Secondly, I would advise that you communicate with your child at a developmentally appropriate level as to what is happening for him or her at this time, why school is closed, and why he or she is no longer attending respite. You may need to create your own social stories to help you with this, or to enlist the help of your service provider to help you in creating a social story. It may also be helpful for you to use the devices your child is familiar with and may be using in school, such as Picture Exchange, the Grace app, or Love. Thirdly, I would advise that you incorporate an exercise routine into your day. Exercise helps to improve sleep, reduces anxiety and agitation, and for most children with neurodevelopmental disorders, exercise helps the child to self-regulate. For those of you who have access to an occupational therapist, it may be helpful to enlist their support to draw up a new exercise program tailored to your child's individual needs during this period of lockdown. If your child is prescribed medication, it is very important that your prescription is up to date and that your child takes his or her medication at the time advised by his psychiatrist. If you have any concerns about your child's medication, the dose, side effects, or any changes to your child's mental health, contact your child psychiatrist to discuss. Psychiatric and mental health services are operational at this time. If you have concerns about new emerging or changes in your child's behaviour, and you have access to a psychologist or a behavioural therapist, it would be important that you contact your child's psychologist to discuss a change to your child's positive behavioural support plan or implementing a new plan. In as far as possible, it is helpful to encourage your child to adopt a healthy diet. I know for many of you, your children may have sensory difficulties and may be quite restricted in what they're eating, and this can be a challenge. Finally, I would advise that you look after your own self-care. This is a particularly challenging time for parents of children with intellectual disability. It is important to be aware that every day is not going to be a good day, and be realistic in terms of what you expect of yourself and your child. Aim to be a good enough parent, and most importantly, call a friend, make a Zoom call, engage in exercise, follow a healthy diet, and try to take some time for yourself. Thank you.